Yeah, I mean, menopause has got a funny term, hasn't it? It's kind of got this taboo around it. It's often called the change. And what does that change mean? You know, even the term the change is quite odd, isn't it? It kind of suggests that women metamorphise into something completely that they haven't been before. So I think generally there's a really poor understanding about what the menopause is. I mean, menopause is a natural state in a woman's life, in a woman's progression. Certainly for some women it can be quite physiologically demanding, and I think when interviewed only 25% of women say they feel prepared for the menopause, that they kind of have the knowledge and information which allows them to progress through the menopause in an informed way. So I think that's quite telling actually. So as a society we really don't support menopause in the way we should. First of all, people don't even really understand what the terms mean. You know, menopause as a term actually means that a woman hasn't had a period for the last 12 months. Generally before that point, there's a period of 4 years called perimenopause when there's quite a lot of metabolic changes. And for a lot of women, for a period of about 7 years, they suffer from quite significant menopausal symptoms. And for 8 out of 10 women suffer some kind of menopausal symptoms. I think a poorly known fact is that 1 in 10 women leave the workforce due to menopause and due to menopausal symptoms. And I think for particular workforces, you know, the NHS is 77% women. The teaching profession is 83% women. Social care is 81% women. You know, for those kinds of workforces, that can have a tremendous effect on capacity and capacity to deliver services. When it comes to menopause, it kind of affects all kinds of physiological processes. So it affects bone health, it affects cognitive health. Some women suffer quite significant vasomotor symptoms, which are things like hot flushes and night sweats. Actually, our understanding currently of how nutrition affects these processes is much poorer than it ought to be. But we've done a lot of work around 2 particular dietary components. One is omega-3 fatty acids. So they're the types of fatty acids you find typically in oily fish or fish oil supplements or the vegan alternatives. And what our research has shown is that as women transition through the menopause, at least in model systems, there seems to be a depletion in brain omega-3 fatty acid levels. And our early work is showing that actually having adequate omega-3 levels during this menopausal transition period or early postmenopause is really important for cognitive health during the menopausal transition, but also for women's long-term cognitive health trajectory and ultimately, I suppose, women's lifelong dementia risk. Yeah, I mean, unfortunately, we're doing a lot better in recent years, but traditionally, I suppose, the white male is the default in medicine and in medical research. And there's a huge leap of faith that diagnostic systems and treatments that work for the white male are likely to be applicable to the wider population, which I think is a huge leap of faith. So I think we need to do far better in being inclusive of everybody in our research programs. And for certain conditions which predominate in females, obviously menopausal symptoms exclusively in females, but also a lot of the autoimmune diseases, chronic pain, are predominantly, you know, often 2/3 to 3/4 of those conditions occur in females. And actually we have a very poor understanding of why that's the case. And we have a very poor understanding oftentimes of how gender and sex affects diagnosis and response to treatment. So I think there now is a wide recognition that we need to do far better in kind of designing our research to ensure it's fit for purpose. I mean, there's a lot of misconception at the moment about whether HRT is a good or a bad thing. The early research was very supportive, the association research, But then as the clinical trials started to be conducted, particularly the Women's Health Initiative study, there was a huge concern that taking HRT could increase your risk of breast cancer. Now, that was a certain study conducted in women who were well past the menopause, and it was conducted with very old synthetic forms of estrogen, not the forms of estrogen we take now. So for most people, especially if they take HRT during the perimenopause or early postmenopausal period, the effects on health and well-being far outweigh any minor risk. There are certain groups of the population, for example, people who are prone to blood clots or people with a history of breast cancer, where HRT may not be the best option. There's not so much known about how HRT affects cognition and long-term dementia risk. A lot of controversy in the field. It started off being very much driven by Davina McCall, and also in Ireland, you can tell I'm Irish from my accent, there was a whole series on a radio programme in Ireland called the Joe Duffy Show, which half the population seemed to listen to. And he spent a whole 10 days a couple of years ago just focusing on menopause. So I think it was first of all taken up by the media, then that started to kind of sort of blend into a policy interest. And there is now an all-party parliamentary group on the menopause led by Carolyn Harris. And she is really trying to engage with all the various stakeholders, from research to NHS to clinicians to women themselves, to start to define more effective policy going forward. I mean, I think effective policy would have a medical profession who are more trained in everything to do with menopause. I think effective policy would have support systems in place that women could access easily. I think there should be effective policy around availability of HRT. There should be effective policy around how we design our work environments to make sure they're kind of supportive of women as they transition through the menopause. So I think it's policy around health. I think it's policy around workforce and work environments. I mean, it's very seldom represented in popular culture. You know, when you think of all the TV programs, the TV dramas that are out there, you know, half of the women adult population are either perimenopausal or postmenopausal. Is there any representation of that in art or popular culture? No, there isn't. So I think it is something that just needs to be really normalized, and that people are exposed to just as part of society and part of normal living. You know, that's a really good question, and there isn't many places. I mean, when it comes to nutrition and the menopause, we've probably all heard of ZOE, and ZOE do a publicly available series of podcasts, and there are a couple of those focused on nutrition and the menopause, so that's a good place to go. Also, the British Menopause Society have a very informative website, and on there is information targeted at clinicians, but there's also information targeted at the general public. So that's quite a good place to go as well. But actually, there isn't that many publicly available, understandable resources at the moment. Yeah, we're a bit short on information that people can access.